Again, I'm putting longer videos. I can't reiterate enough over and over for the pain control. It is Monday, June 12th. I have been asking and talking about, on a scale of 1 to 10, level 10 plus pain, 24, 23, 22, 21 hours. And the little tiny half pill of Dilaudid they gave me was a minuscule dose, has not been cutting it since the beginning of the pain escalation. The doctor's been notified more than once, twice overnight. Another doctor's been notified. We're in a hospital. I have an IV. Until a patient is suffering level 10 pain, I don't want to live. Give me something, and don't give me a pill that's going to take 2 hours to work, and don't give me the same pill that isn't working. Up the dose, change it, combine it with something I don't care, figure it out, and put it in the IV. Not for the rush, but for prompt relief, and so I can get some sleep. I haven't slept in a year and a half. I was just starting to get some sleep when this was happening for like the third time in 4 months. We're going to send you home. There's no IV medication at home. I heard this in March. They gave me pain meds before, and they've been taken away. Now I have infection, escalation, back pain, not sleeping. It's all contributing underlying disease. We can't find an answer. Whatever the reason is, I have pain. I'm crying my eyes out all the time, making congestion worse, and I'm not sleeping. And I'm getting weaker because I'm not sleeping. And the pain. Everything combined. You can't find the underlying cause. It's not my fault. Inflammation. I have inflammation eating my lungs with no underlying disease after all these tests. That seems impossible that I die from inflammation this day and age, or have my health go down so far, and combine all these other things. It's killing me. It's killing me nice and slow. That I can figure out. Anybody can tell you that, even if you won't say it. The fentanyl crisis, worried about addiction, push that out. I don't want to hear about it anymore. Doctors won't discuss it, but they're scared of that. They're afraid of addiction. There's a higher risk of addiction with IV meds, but they tell you, oh, because it doesn't last as long. Oh, because you're going to go home. I don't care about that. I'm sorry if your jobs feel threatened and they got you running around scared because of news media and politicians. I'm sorry. That's not right. It hasn't improved the fentanyl addiction crisis, the homeless crisis. Nothing's improved. It's gotten worse. But patients in pain, even though I don't have cancer or scheduled surgery today that I went through, I'm in pain. It's level 10 plus pain. And I can't sleep with it. And I'm never going to get anything else better with that. Even if I do get better, I'm not going to want to live. I'm going to give up. I already have. So please listen. Start listening. Stop being afraid of your patients. I'm not looking to file a lawsuit or throw anybody in jail because of some weird addiction thing. I'm not an addict. I'm looking to file a lawsuit or have somebody tossed away for leaving me in this kind of pain. That's where my mind would be for all this. Now, if we can get everybody else on board with that, I'm worried about human beings suffering, patients suffering, instead of the addiction crisis, we'd be in much better shape. Only a small handful of people walk out of here with an addiction. Chemically, your body gets dependent on it, step down the dose. But as far as wanting to party with it and keep it up afterwards, for a rush or whatever else with addiction, very few people end up in that air. What is happening is how humans, flesh, in the flesh, tears, crying, suffering, and death coming from it, just from the pain alone. If somebody doesn't off themselves, what about heart attack, stroke, and all the stuff that comes from not sleeping because you're screaming in pain all day and all night long? And your condition, which will get worse, or immune systems that'll be lowered for infection. Just from the pain itself. Just from the pain itself. Let alone the not sleeping and all the other crap. I can go on for another 20 minutes that nobody has the time of day to watch. 30 hours of pain control, and I've got a half pill of Dilaudid that takes 2 hours to work that I don't feel pain relief from. I'm telling everybody, every CNA, every nurse, and every doctor that I could get contact with anyway. And the messages the nurse sent. It shouldn't take this long to get pain control. At a conservative health center, at a liberal one, it don't matter. Memorial Care, St. Joseph, Fountain Valley, it doesn't matter. Yeah, Dilaudid, morphine, severe pain. What am I supposed to accept? Something less than that makes me constipated, vomit, nauseated, to get no relief. That's what the nausea medicine's for. That's what stool softener's for. If need be, which I don't have a problem with yet, except for nausea. I hate the rush. I deal with it. Feeling hot, prickly. I hate all that crap. I hate nausea medication, but oh well. You put up with it for a couple minutes and then the pain goes away and then I can sleep. That's what I care about. So if you're a doctor or a nurse and you're afraid of addiction and laws and controlled substances, I'm not saying to break the law, but for frick's sake, I already want to give up from the disease, from this unnamed disease that's ruined my life that nobody has an answer for, which I think you do. But we don't want to talk about it, do we? When everything else has been ruled out, I think I know where this may have came from. But whatever. Don't leave me in pain, whether we know it or the name of the underlying condition or not. Stop doing that. Stop making me fight for days to get one dose of pain medication and IV only to get it taken away and end up this way again. Stop it. Please. You're messing with my mental health and my physical health, my sleep, my will to live, not drug addiction. And there's no politician, no law, no skin color that's going to discriminate between that when it comes to suffering in the flesh and death. That does not discriminate, period. No prosecutor or no news media can ever change that, and no fentanyl crisis, which will not be solved on the street to begin with. It's only gotten worse, it's not helped. Will have anything to do with that. It'll still leave patients in suffering. Stop punishing the patients. Be conservative when you have to, but not with people of level 10 plus pain. It's not always a C-word cancer that gives you the worst pain in your life that people can experience. There's a lot of other things, including stuff that's unnamed. Start paying attention, please. This goes out to everybody. I know nurses can't cross a line. Only what's on your doctor's order, so doctors got to take responsibility for this too. And if it comes to having to go and speak out about it publicly, you're afraid of your careers, I understand that, but then do it, because there are people suffering. It's worth it. When it comes to patients like me that just want to give up and die, we will, in agony, after being in agony for so long. Isn't it worth it? I'd do it. I'd do it to myself to save someone else. Do whatever it takes. But I shouldn't have to wait 30 hours for pain control when I'm suffering on a level I can't even put into words. I don't know what else to say.